gynecology in Gurgaon from Well Women Clinic, and I work as a director in the Department of Obstetrics and Gynecology at Fortis Memorial Research Institute, Gurugram. So today I am here to discuss with you all a very important topic which is very close to me, as well as lot of you feel this during your entire life cycle from menarche to menopause. And this is a topic which is very less commonly talked about, and this is period pain, or what we call as menstrual pain or menstrual cramps, and in our technical language we call it as dysmenorrhea. So dysmenorrhea means painful menses. तो ये किसको होता है? It happens in women who are menstruating. That means any woman between menarche to menopause can suffer from this menstrual pain. It usually happens in almost 80 to 90% of women, ranging from mild to moderate to severe. Although severe and moderate kind of pain is much often ignored, it is much often misunderstood, and lot of times women are put to blame that you are only making a fuss, or the problem is only in your head and this is not your period pain. So please, for all those who are listening, we should not ignore any kind of pain that happens during periods which lasts for a longer time, which is more severe than what it was maybe last month or maybe 6 months earlier. A pain which is progressive, which increases every cycle, and pain for which you are not able to look for any other reason. We need to evaluate this kind of pain. So let us discuss what is this commonly talked about pain that we are here for, and that is called dysmenorrhea. So usually this dysmenorrhea is of two types. One is primary, which is physiological, that happens in most of the women, and usually it gets relieved by home remedies or maybe by mild analgesics. But yes, there is kind of pain which is moderate to severe, and for which we are there to guide you, to let you know that what needs to be done. So sometimes there are causes other than primary dysmenorrhea where we need to rule out some structural defects. And what are those common causes? They can be due to fibroid in the uterus, it can be due to adenomyosis in the uterus, it can be due to pelvic inflammatory disease for women who are sexually active, and another most common reason is endometriosis. So we are here today to talk with you about endometriosis. So, what is this endometriosis? So, endometriosis is a condition which affects almost 1 in 10 women worldwide. So, you can imagine how many women must be affected by this condition and are suffering in silence because of this condition, and it does not get relieved by regular home remedies or by analgesics that you take. You will need multiple doses of oral analgesic, maybe sometimes injectable. This pain will not disappear when your periods are over. It can continue. It can come in the form of chronic pelvic pain, where pain will be continuous. So, worldwide, if we look at the worldwide data, almost 200 million women are affected by this condition. And let me also take you to the facts related to this condition. First and foremost, almost 20% of the women have never heard about this condition. Or let me put it another way, that 20% of women have only known about this condition. 80% are unaware that this is endometriosis. Another thing, 33% of women suffer from depression because of this. Another 33% are told by their general practitioners or by their primary care physicians that something is going on in your head, that is why you are aggravating your pain. Another 33% of women think that whatever pain remedies I'm taking, there is no relief as to whatever treatment I have been offered. Almost 45% of women suffer from family or friend relationship issues, and another 50% suffer from fertility issues. Even more than that, women who are working or women who are housewives or are homemakers working from home, 80% of them have to miss their work when they are going through such a bad condition. So you can imagine the kind of severity it brings with it, which leads to disruption in their daily life. So any woman whose periods are much longer, you have more blood flow, or your pain is so severe, then you need to visit a doctor. But why does this pain happen? This pain happens because of release of a substance which is called prostaglandin. So prostaglandin is the one which is responsible for pain, and it causes contraction in the uterus. But why does this pain happen during your period or during your menstrual cycle? Because the uterine lining, which is preparing itself for a pregnancy, when it does not happen, it sheds every month. So, shedding of the uterine endometrium will lead to pain. Now, what happens to women who have endometriosis? So, women who have endometriosis have similar lining which is in our uterus at locations other than the uterus. Where it can be on your ovaries, it can appear as chocolate cyst on your ovaries, it can be anywhere in the pelvis, it can be on the posterior surface of uterus, the pouch of Douglas, the bladder, the bowel, and so many other places, which is causing your pain to be incredibly severe, for which you are not able to look for any home remedy. And again, you visit a hospital, you visit a doctor to look for injectable pain killers to treat this problem. So, what should we do? So, this kind of pain will not only be pain, but it will be associated with fever. It can be associated with pain all over the abdomen. There might be nausea, you might vomit, some might also have diarrhea or constipation, and so on and so forth. And your remedies like use of heating pad, which you all do, taking lot of water, exercising, uh, all these measures don't help. So those measures like reducing your caffeine intake, reducing your alcohol and smoking, taking lot of fluids, taking mild analgesics like maybe ibuprofen, maybe acetaminophen, mefenamic acid, naproxen, which are the first line recommended drugs for management of this condition, also start failing. You need to keep up popping pills. So what should we do? Let me also tell you that this disease has also affected many women, especially celebrities all over the world also have suffered from this condition. So we should be more open on talking about this condition and not limit to ourselves. So if we talk about celebrities, you must be knowing Katrina Kaif, although she is not married, Selena Jaitley, Tony Braxton, Padma Lakshmi, Whoopi Goldberg, and Dolly Parton. And there are so many others. They have all battled endometriosis. So, this is a condition which we have to talk about more often so that women are open to visit to their doctor, their gynecologist. So, this unbearable pain, which is seen in almost 1 in 10 women, what should we do? So, when women come to us with these problems, most of them ask us that who gets this endometriosis, किसको ये हो सकता है, and what is the cause. So usually we don't know what is the cause for this endometriosis, although there are many theories which have come up. Some of them can be that if you have a family history, that means it is genetic. Maybe it is environmental. Maybe there are some anatomical causes which are leading to development of endometriosis. Next thing, that who gets this endometriosis? Can a young girl have it? Can a girl who has not started her periods have this endometriosis? No. So endometriosis will only happen in women who are menstruating. And women who are menstruating means when you start your cycles at the when you are Premenarchal when you are in the menarchal age, which is maybe around 10 to 14 years of age, anytime when you start your menses, during your entire reproductive lifespan till menopause is the time that you can suffer from endometriosis. So, what are those common symptoms that you should look for that it can be endometriotic pain? So, firstly, which we talked about is painful periods, which are extremely painful. The pain is debilitating. Other than that, this pain will not disappear once your periods are over. It will continue. It can continue during the entire cycle, during the entire month, which is called chronic pelvic pain. You can have pain while passing urine, that is dysuria. You can have pain while passing stool, dyschezia. You can have pain while having intercourse, which is called dyspareunia. So it can manifest as pain in so many other ways. Other than that, when you go for an ultrasound, due to whatever may be the reason, sometimes what we can see on ultrasound is chocolate cyst in the ovaries. That is also one of the signs for endometriosis. While evaluating reproductive age women for fertility, sometimes we are not able to find any reason that why she has fertility issues. The male factor is normal, the tubes are patent, you are young, eggs are forming, everything is okay, but fertility is still a concern. The fertility issue is still unexplained. So, there is a chance that you might have endometriosis. So, how do we diagnose this endometriosis? Diagnosis, the gold standard is only by laparoscopy. So, by laparoscopy, we will be able to see endometriotic implants all over the pelvis, on the bladder, on the bowel, in the ovaries, in the pouch of Douglas, and at multiple locations. So, that is the gold standard. So, what happens every month? When you bleed from the uterus, the bleeding also happens in these endometriotic implants. So, which leads to pain, which leads to inflammation, and in the long run, you can also have scarring of these lesions. So, when we do a laparoscopy, what we do? We coagulate these implants or we cauterize them, and sometimes when the chocolate cysts are big and fertility is an issue, then we do endometriotic cystectomy. Another reason why endometriosis leads to fertility issues is not because of the tubal block, but the tubal relationship with the ovary can get altered. Other than that, sometimes the egg quality is also not good, leading to fertility problems. Next is, lot of women ask us that lot of women sometimes ask us that why it is happening and why, what is the cure? I don't want to suffer from endometriosis in my entire lifetime. What can I do? What is it? What is the cure? We are looking for cure for every disease, whether it is diabetes, whether it is hypertension, whether it is polycystic ovarian disease in women. Similarly, for endometriosis, there is no cure. But yes, we can offer you medical treatment, we can offer you surgical treatment, which will relieve your pain for a long period of time so that you can have a good quality of life. So, yes, treatment options are available. Some women also ask us that is this sexually transmitted? I never had this problem in my childhood. Only after marriage it has aggravated. Yes, after marriage it is not aggravation, but maybe you have been able to find out that you are having pain during intercourse. So maybe dyspareunia is your only symptom. Another thing, you are planning for a baby, but it has not happened. So, but you need to keep in mind that this is not a sexually transmitted disease. This is not an infection which is sexually transmitted. But is this hereditary? Like so many other cancers, is endometriosis hereditary? Can we inherit from our parents or maybe from our relatives? It has been seen that women with first degree relatives have sevenfold higher risk of developing endometriosis. Another thing that comes to your mind when you have been diagnosed with either polycystic ovaries or with endometriosis is that can I conceive? Will I have fertility issues? But You don't need to worry because not all women with endometriosis will have fertility issues. Yes, it affects almost 40 to 50% of women, but not everyone. Everyone will not have fertility issues. Another thing, even if your endometriosis is very severe, it does not mean that you will have symptoms according to the severity of your disease. Sometimes the disease is very severe, but you have no problem. There are no symptoms, there is no fertility issues. And at the same time, when the disease is mild, based on our tumor markers, based on our ultrasound, on our MRI, on clinical examination, or on laparoscopy, you have been labeled as a mild disease, but your symptoms don't match to the severity of the disease. So sometimes it is an enigma. So you don't need to worry even if it is severe unless you have symptoms. So coming back to what is the cure? So we just spoke that there is no cure. The only cure is when your family is complete, we will remove the uterus along with tubes and ovaries and other endometriotic implants that are in the pelvis. So, mind you, only removing uterus, tube, and ovary will not relieve you of the problem unless we also treat the endometriotic implants which are elsewhere in the pelvis. Another thing that comes to our mind whenever we have any medical problem is it cancerous? So, yes, you should think about this. It is not cancerous for many women, but rarely. When the chocolate cysts are too big in size, they are appearing again and again, and the tumor markers are very high, there is vascularity on ultrasound, there are chances that it might turn into malignancy, which can be endometrioid adenocarcinoma. Another thing, can I prevent this? My sister has, my mother has, my friend is also suffering from the same. Can I prevent endometriosis to happen? So, no, there is no way to prevent endometriosis. But whenever it is diagnosed, there are measures that you can take so as to reduce the severity. And the treatment for your disease will depend on your age, the severity of your symptoms, whether your family is complete, whether you are married, or whether you are planning your baby. So let us discuss about what can we give once the diagnosis of endometriosis is confirmed. First and foremost is the mild analgesics, which you have also been taking at home, but as gynecologist, she will also prescribe non-steroidal anti-inflammatory drugs, and they are not harmful. They are not steroids. They are not hormones, and they are offered as first-line treatment. What will they do? They will reduce the production of prostaglandins and help you to relieve your pain, and they can be only used at the time of your menstrual cycle. Some women are also offered progesterone only therapy because that will suppress the lesions. Or even sometimes oral contraceptives have been prescribed to you to relieve you of this pain, which can be a combination of estrogen and progesterone. Although there has been lot of controversy giving oral contraceptives, whether it will aggravate the disease, it will reduce the disease, and especially Indian women don't want to take hormonal pills or oral contraceptives as far as any disease is concerned. So, what is the right treatment for you? Now, with advancement in technology and with enough research, we have a better molecule to treat your endometriosis, which can be given to teenagers, which can be given to women who are not planning a baby, women who are perimenopausal, also to women who have been operated for chocolate cyst, and following which we give that drug for a short interval, maybe 6 months, maybe 1 year, to suppress your menstrual cycle, to suppress the size of the lesion, to prevent the recurrence. And that drug is easily available on your doctor's prescription in India and everywhere across the world. And there has been enough research that it will help you relieve your symptoms. But You should not go and buy this drug over the counter. It should be a prescription drug with your doctor. Sometimes women also come to us saying that my pain is very severe, my bleeding is much more than others. So, just heavy bleeding does not mean that you have endometriosis. There are other reasons for heavy bleeding. It can be fibroids, or it can be polyps. It can be cancerous in women who are perimenopausal women. Then you might have fibroid polyps. There can be cervical erosion which bleeds during intercourse. So we need to rule out that any woman who is bleeding heavily is not because of endometriosis. Another thing that comes to your mind is my pain is serious and it is much more than normal. Now, the pain was only during my menstrual cycle. Now, it happens when I go to the bathroom, it happens when I have intercourse with my period, it happens in between periods. So, it is interfering with my daily routine. So, it is important that you get yourself checked. There is another myth which is related to this topic is that you cannot get endometriosis if you are young. So it does not mean that, but it means that yes, the earlier you have your menarche, the earlier your cycle starts, the longer is the duration of your period, the more chances you are likely to have endometriosis. If you have a family history, the more chances it is that you might have endometriosis. Another thing which we just talked about, that 33% of women are blamed that something is there in your head which is causing you so much pain, causing you so much nausea. We all know that endometriosis is a physical condition, but yes, because of severe pain, sometimes they suffer from depression, they suffer from mood swings, and it becomes a psychological condition. It becomes a mood disorder. So we need to keep that in mind as well. The next thing that we come to is that you can't get pregnant, which we have already discussed. You have endometriosis does not mean that your pregnancy will not happen. So we need to keep in mind that it runs in families. So it is very important that we are able to diagnose this condition. And mostly what happens is that we are not able to find it at the right time, treat it at the right time, so that women lead a better quality of life. Sometimes it takes 7 to 10 years to diagnose this condition. It takes a long period of time. Mostly it is misdiagnosed, mostly it is underdiagnosed, and we are not able to find out what is this condition which is leading to severe kind of pain. So now we can take some questions from the live chat. If you have any questions, we can discuss them further. Someone is asking that how long you are recommending medical therapy in endometriosis patients. Yes, so medical therapy, which I just discussed, if it is only in the form of mild analgesics, we can go on like this. If it is not interfering with your daily life, it is good enough, but we should not take strong analgesics that will put strain on the gastrointestinal system. Another thing, if we are giving specific drugs for endometriosis, it has to be under supervision. It cannot be over the counter. It has to be in consultation with your gynecologist so that we are able to give the right treatment. Another question is so very important is that you have to be concerned about and not ignore these symptoms that you have at the time of your periods. It is very important to keep a track of your menstrual diary, to keep a track that how many days of pain you have, how many days of bleeding you have, and how long does it last, and whether you are getting relieved from your regular routine treatment or not. So it is very important that we need to rule out structural causes which are related to this. So another question is that you can take mild analgesics. Yes, mild analgesic will not do any harm. So you don't need to suffer. Mild analgesic can give you lot of pain relief. So it is very important that you need to discuss this problem with your family, with your friends, with your doctor, so that the more we delay the diagnosis, the more is the problem that we face longer in life. So there will be more pain that you will suffer from, there will be more inflammation, there will be more swelling and more scarring, and it becomes more problematic to treat when the disease advances so much. There is one more question that I have had surgery for endometriotic cyst and it has come back again in next 1 year. So what can we do? Yes, this is a tricky situation because endometriosis is known to recur. Why it is recurring again and again is because of the excess estrogen in your body. Estrogen is the hormone which is causing the disease to proliferate more. So there is a hyperestrogenic state in the body. So it will come back again and again. You have been given the best treatment. Your surgery went out very well. Still, endometriosis comes back to you again. So, yes, it is known to recur. It is kind of a disease which will come back. But the best way is that we go to the right doctor, we are able to diagnose at the right time. Research says that the diagnosis takes almost 7 to 10 years from the time when the symptoms start, and we are not able to exactly find out. But now the time has come that we have to remove this stigma on talking about menstrual pain, talking about period shame, and also concerning the menstrual problems that women face, whether it is excessive bleeding, whether it is irregular periods, whether it is pain during periods. And excessive pain during period is not a normal thing. The sooner we shed the stigma, the sooner an endometriosis girl can receive treatment and the support that she needs. So let us all join hands together to create awareness on this very important topic so that women can openly talk about their issues, discuss their issues, and get the right treatment at the right time. Thank you.